The patient exhibits a tracheostomy tube and site free from drainage secretions and skin irritation or breakdown. Equipment: check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit. If available, be sure to collect supplies listed that are not available in kit, or 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, pre-cut and sewn surgical dressing, sterile basin, small sterile brush, pipe cleaner, disposable inner cannula, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves, mask, goggles or face shield, hydrogen peroxide, PNSS or sterile water. Implementation: bring necessary equipment to the bedside stand or overbed table. Perform hand hygiene and put on PPE if indicated. Identify the patient. Close curtains around bed and close the door to the room if possible. Determine the need for tracheostomy care. Explain what are going to do and the reason to the patient, even if the patient does not appear to be alert. Adjust bed to comfortable working position. Usually elbow height of the caregiver, lower side, rail closest to you. If the patient is conscious, place him or her in semi-Fowler's position. If patient is unconscious, place him or her in the lateral position facing you. Move the overbed table close to your work area and raise to waist height. Check for lung sounds. Place a towel below the trachea sides, covering the neck and chest of the client. Put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove and solid side dressing and discard. Before removal of gloves used to perform suctioning. Prepare the basins and cleaning solution. Mix sterile PNSS and H2O2 in one basin. Be sure it will fill 0.5 inch up the basin. Add another PNSS in another basin that will fill up this half inch. Perform gloving, cleansing the tracheostomy. Remove the oxygen source if one is present. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release. Lock. Gently remove inner cannula and place in first basin with PNSS plus H2O2. Let it submerge there for a few minutes. Simultaneously, gently slide the trachea pad, dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, inflammation. Clean the inner cannula of the trachea tube using the prepared PNSS. H2O2 use brush to remove solidified or sticky mucus. Rinse using the second basin with PNSS only. Discard gloves and put on another glove if necessary. Dry the inner cannula using sterile gauze or pad. Gently reinsert it back to tracheostomy tube. Be sure it's properly locked. Dip cotton tip applicator or gauze sponge in copper basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once moving from stoma's side outward. Pat skin gently with dry 4x4 gauze sponge. Slides commercially prepared tracheostomy dressing or free-folded non-cotton fill 4x4 dressing under the faceplate. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Reapply oxygen source if necessary. Remove gloves, assist patient to the comfortable position. Raise the bed rail and place the bed in the lowest position. Remove additional PPE if used. Perform hand hygiene. Documentation. Reassess patient's respiratory status, including respiratory rate, effort, oxygen, saturation, and lung sounds.